Hello, I am Jamaras Nettles, and this is my media project on patient navigators. In my presentation, I will go over several different things, including an introduction into patient navigation, some of the education and qualification requirements, professional organizations and certifications, as well as some of the pros and cons to being and using patient navigators. Introduction. Navigators are specially trained professionals who work one-on-one with patients to provide support as well as reduce some of the barriers that come along with receiving healthcare. Patient navigators can do several things, such as organize transportation to and from appointments, conduct home visits, find and conduct support groups, go to appointments with patients, provide basic health education, as well as help manage and coordinate care between several healthcare providers. Navigators can come from a variety of backgrounds. They can be professionals like social workers, nurses, and other healthcare professionals, as well as lay people with specialized training. The use of patient navigators has led to an increased access to care, better care integration, better treatment adherence, as well as improved communication and trust between patients and providers. Navigators can work in a variety of settings. Most commonly, we see them in the clinical/hospital setting, where they work with healthcare providers to coordinate care, as well as answer any questions patients may have. You may also see them at the community level, working to find or create support groups, or to find resources for patients to help reduce disparities. Patient navigators can work part-time or full-time, and often work 8 to 12-hour shifts, depending on the work setting. Example of a patient meeting with their patient navigator. She was recently diagnosed with cancer, and they are going over her treatment plan and her schedule for upcoming appointments. They are also reviewing any potential questions she may have for her doctor or providers. And qualifications. When it comes to being a patient navigator, the only education required is a high school diploma. However, it is suggested to have a bachelor's degree as well to make yourself more competitive in the field. Specialized training or courses are not required, as many employers will provide on-the-job training. Some of the skills needed to be successful as a patient navigator are communication, coordination, planning, time management, interpersonal skills, as well as problem solving. Professional organizations. Academy of Oncology Nurse and Patient Navigators, or AON, is one of the professional organizations that exists for patient navigators. Their goal is to advance the field of oncology patient navigation by providing space for collaboration and resources for development. They do this by creating local collaboration networks and leadership opportunities, developing best practices for patient care, and continuing evidence-based research. There are several benefits to membership of this organization, such as conferences, access to journals, and access to committees. Certifications. American Cancer Society Leadership in Oncology Navigation Certification, or ACS Lion, is not a national certification. However, it does meet the standards set by the Professional Oncology Navigation Task Force. The certification is not just for patient navigators, but for anybody interested in oncology patient care. It meets the standards set by the Centers for Medicare and Medicaid Services. For this certification, you must be 18 years or older and a part of the U.S. or its territories. The certification needs to be renewed every 3 years. Pros and cons. Some of the pros to being or using patient navigators. They provide evidence-based education to patients and enable them to make informed decisions. They provide support to patients and connect them with community resources. They work to reduce barriers restricting access to healthcare. They build relationships with patients and their families, as well as providers and organizations. They work to restore patients' trust in the healthcare system. They get to work with a wide range of populations and build cultural competency. And lastly, it is a growing field, and there will continue to be a need for them. Cons to being or using a patient navigator. It is a new field and isn't widely known. They may need to clarify their role. It can be emotionally taxing working with serious diseases and fighting against disparities. It is a heavy workload managing several patients, each with their own individual needs. There is not a national certification or training program, and most navigators are taught on the job. The average salary in the U.S. is between $40,000 and $50,000. Coordinating communications between providers and staff can be difficult. Conclusions. Patient navigation is a new role in the healthcare field, but it is an important one. Navigators work with patients to ensure that they are getting the most out of their healthcare experiences. They will continue to be important as we continue working on reducing healthcare disparities and focusing on equity. Here are my references. Thank you for watching and listening.